Hey, my name is Jack McClane, and I'm a psychiatrist here at Sierra Tucson. And this is a quick introduction to acceptance and commitment therapy. This is me with my dog, Lucy. This is me, Jack, in the front, and that is Lucy in the back. So I really just have two main objectives for this talk. The first is that if in about 2 weeks from now somebody asks you, what is ACT, you could still give them the basic concept or the basic gist of the idea. And then the second thing I really want to do is teach at least one basic ACT intervention in this talk. So what is ACT? It literally stands for Acceptance and Commitment Therapy. It's pronounced ACT because it's an action-based therapy. If you call it ACT, the hardcore ACT people will make fun of you behind your back. One definition I found for it is that it's an existential, humanistic, cognitive behavioral therapy. Now, I only kind of know what each of those words means individually, and you put them all together, I'm not really sure what that means, but I think it sounds smart. Maybe a more usable definition is ACT as a mindfulness-based behavioral therapy with a goal of creating a rich and meaningful life, and at the same time, accepting the pain that life is certain to bring. I think that may be a more usable definition, but so I have a friend who's a screenwriter in LA, and he's always pitching me movie ideas, and he'll pitch something like, we have this down on his luck boxer, and he has to fight a great white shark. It'll be like Rocky meets Jaws, which sounds terrible. And so here's my pitch for what ACT is. It's like mindfulness meets Viktor Frankl. Probably everybody out there is familiar with mindfulness and what that is. Probably most of you out there are familiar with Viktor Frankl. But if you're not, he wrote a wonderful book called Man's Search for Meaning. And he put forth in it the idea that the most important thing is for a person to figure out what their sense of purpose is, or to figure out what gives their life meaning and value, right? And if a person understands their purpose, then they can deal with virtually any pain, any suffering that comes up in their life because they understand why they have to bear it, why they have to deal with it, right? And so I really see ACT as a combination between mindfulness ideas and for the lack of better words, what we'll call these Viktor Frankl ideas. It was developed by a guy named Stephen Hayes in the 1980s, although lots of other people have worked on it since then. And it's considered a third wave cognitive behavioral therapy. The first wave are things like classical conditioning, you ring the bell and my dog Lucy starts to drool, and operant conditioning. The second wave is cognitive therapy and rational emotive therapy. And the third wave includes things like ACT, dialectical behavioral therapy, mindfulness-based stress reduction, mindfulness-based cognitive therapy. Something that's interesting about the third wave of these therapies is that they all have a mindfulness component to them. Another interesting thing about ACT is that it was developed in conjunction with its own basic research program called Relational Frame Theory, or RFT. And relational frame theory looks at how thinking is affected by human language, or maybe we could say how human language affects thinking, right? And RFT is fascinating. It's far beyond the scope of this talk. And the nice thing is you don't have to really understand it to be able to use ACT. ACT is kind of like knowing how to drive a car, and RFT is like understanding how the engine of the car works. So what are some things that are unique or different about ACT? One thing that I find kind of fascinating is that symptom reduction is not a goal, although it often ends up being a byproduct. All right, and we could take it as example, agoraphobia. So from an ACT perspective, your goal is not to get that person to be able to leave their house. Your goal is to get them to live a life that they find worth living, a life that they find meaningful. And if they're able to do that without ever leaving their house, then fantastic, right? Of course, the secret ends up being that for them to lead a life that they find worth living, they often end up having to leave their house. Another concept I want to mention is one of healthy normality. And this is the idea that humans are naturally psychologically healthy and will naturally be happy if given a healthy environment, lifestyle, etc., right? And that psychological suffering is abnormal and pathological. ACT soundly rejects this idea. does not believe in it. And if you look at the beginning of most ACT books, you'll find they always cite a lot of statistics about how extraordinarily prevalent mental health issues are, how extraordinarily prevalent psychiatric disorders are in the population, and not just how prevalent they are, but also how extremely common, things like boredom, loneliness, the pain from divorce, bullying, existential angst are, right? And so ACT puts forth the idea that a certain amount of suffering is actually normal, and that if you were to be happy all the time, that's actually what would be abnormal. And ACT believes that it's the psychological processes of the human mind that can often be destructive, and chief amongst these is language. And they really look at language as like a double-edged sword. Language allows us to build civilizations, to give webinars, but it also creates a lot of our ability to criticize and judge and belittle and make ourselves miserable. And that brings us to kind of our first major concept that I want to take a moment to address. And for this, right now, we'll just call it the negative feedback loop from hell, right? And so this is the idea that we have a person and they're feeling depressed. They're feeling a lot of depression, right? And then they have a thought that goes with that depression. It's something like, I'm not supposed to be this depressed. I'm supposed to be happy like everybody else. When I go on Instagram, I see everybody else, they look perfect in their bathing suits and they're all hanging out in Hawaii with their best friends and they're all laughing and they're having such a good time. And I'm supposed to be like that. I'm not supposed to be depressed. And that person ends up feeling sad about the fact that they're depressed, which of course just feeds back on itself and makes the depression worse, right? And we could do this with virtually any set of emotions. You could have a person who's feeling a lot of anxiety, and they have a thought like, this shouldn't have made me so anxious. This shouldn't be bothering me so much. Other people can handle this so much easier, so much better than me. And they're feeling really frustrated about how anxious they are, which of course would just feed back and make them more anxious, right? So ACT is by no means the only type of therapy or type of psychology that's come up with this idea. You can look and many different schools of thought have come up with similar ideas. If you look at the DBT book in my office right now, they would put up the same concept, and they would call these primary and secondary emotions, right? And they would call this top one the primary emotion and the bottom one the secondary emotion. And the secondary emotion is the emotion you feel about the first emotion, right? And so one thing that's kind of nice about ACT, and if you read most ACT books, they're rich with wonderful metaphors. And ACT uses a number of different metaphors to describe this process or this feedback loop. And the first one I want to talk about is clean discomfort versus dirty discomfort. And so ACT would put forth the idea that this first emotion right here, this primary emotion, is clean discomfort. If we're going to go through life, no matter what, we have to experience a certain amount of discomfort. But it's the second emotion that they call dirty discomfort. And that's something we do to ourselves by not accepting the first emotion, right? By struggling with the first emotion, we create this dirty discomfort. Which brings us to the next metaphor I want to point out, which is what they call the struggle switch, right? And they would say when the struggle switch is on, you're fighting this first emotion. You're not accepting it. And so what they ask you to do is turn off the struggle switch, accept this first emotion, and short circuit this feedback loop. And there's a nice quote that I think really sums up this concept well, and that's the desire for more positive experience is itself a negative experience. And paradoxically, the acceptance of one's negative experience is itself a positive experience. And so I've come up with my own metaphor or my own example to try to illustrate this point, right? And so here again is my dog Lucy, and Hazel, the golden retriever, who's her best friend, is going to represent Lucy's depression, right? And so in this example, Lucy is engaged in struggle with her depression, and she's biting her depression in the ear. And all she's getting out of it is she's getting her right paw chewed up. And so what we want Lucy to be able to do is to see if she can stop fighting, she can stop struggling with her depression, and just accept it and allow it to be there. And so let's see if she can do that. And so here we notice Lucy has stopped her fight with depression. She's no longer biting it in the face. The depression is still there, but she's accepted that it's there. And this is going to free Lucy up to focus on her values, to focus on what she cares the most about. And I can tell you from a great deal of observation that the thing she values the most in the world is pulling all the stuffing out of stuffed animals. And she's shortly going to be able to do that with the cow here. So if you look at the beginning of most ACT books, you'll see a figure kind of like this, and they call it the hexaflex, right? And around each point of this, they have each of the 6 core values of ACT. And if you were an ACT therapist, when a patient first came in and saw you, one way you might do your formulation is to evaluate the relative strength and weakness of a person in each of these 6 core processes, right? If we look at it, and then you would focus on the ones that were weakest first, we can look at it and it might look a little bit overwhelming, but we can kind of think of it as that 4 of these processes are really just mindfulness ideas, right? And then 2 of them are what I was referring to before as sort of the Viktor Frankl concepts. And so what we're going to do right now is take just a moment and look at each of these 6 core therapeutic processes. So the first one is contacting the present moment. And that's really just the idea of be here now. It's learning to bring our attention to the physical world or to our psychological world. And this is the idea that we're not, when we're doing this, we're not absorbed in thoughts of the dead past or the imagined future. Right? It's just focusing on the present moment. The next concept I want to touch on is a big one in ACT, and this is diffusion. And before we can really talk about diffusion, we first need to define what ACT means by fusion. And when ACT is talking about diffusion and fusion, they're really talking about concepts of how we approach thoughts, right? And so in ACT, they would say when you're fused with a thought, that means the thought pops into your head and it can seem like the absolute truth, right? A thought can seem like a command you have to obey, a rule you have to follow. It can seem like something that is happening right here and now, even though maybe you're really just remembering something from the past or imagining something from the future. And so they contrast this with the idea of diffusion. And when we're in a state of diffusion, the mind has the ability to sit back and watch itself think. This is the idea that you can step back from your thoughts, images, and memories and just watch them come and go. The metaphor you see used all the time is clouds. You know, thought is like a cloud and it floats into the mind and you see it float in and then you can watch it drift across and float away. And so I'd actually like to practice a diffusion technique right now. And before we're able to practice a diffusion technique, first we need to fuse with a negative thought. And so this is something I'd like everyone to try right now along with me and to really do this. And so the first thing we need to do is bring to mind a thought in the form of I am X, right? And X is going to represent something, a negative thought or belief you have about yourself. And try to pick something that really bothers you and that actually occurs. You know, examples are like, I'm not good enough or I'm incompetent, right? And just pick the first thing that comes to mind and go ahead and do that right now. Think, I am X. And I'd like you to focus on that thought and believe it as much as you can for about 10 seconds. And go ahead and do that right now. And now go ahead and take a second and notice how you feel. And now we're going to start the diffusion part of this, right? And so let's take that same thought, I am X, but now we're going to put a prefix in front of it. And I'd like you to think the thought, I am having the thought that I am X. And go ahead and do that right now for about 5 or 10 seconds. And take a second and notice how you feel. And now we're going to add one more step to this. This time, I'd like you to make the prefix a little bit longer and think, I am noticing that I am having the thought that I am X. And go ahead and do that right now for about 5 or 10 seconds. And take a second and notice how you feel. So not everybody every time, but what I've noticed is most people, most of the time when they do this exercise, they feel like that thought becomes a little less powerful. They feel like they have a little bit of extra distance or a little bit of extra space between themselves and that thought. This is just one example of diffusion technique. There are dozens, if not hundreds, of different diffusion techniques that can be used, right? And, you know, really the goal of diffusion techniques is to see that thoughts are just words and images passing through your head. And you want to notice them, accept that they're there, but not try to change them. And the secret ends up being by noticing them, they sometimes end up having less power. And so the next point along the hexaflex, this six-sided figure I want to bring up, is one of acceptance. And acceptance here is contrasted with experiential avoidance. And just like with diffusion and fusion, we're really talking about ways to deal with thoughts. Here, we're really talking about ways to deal with emotions, right? And so ACT puts forth the idea that a lot of human suffering comes from this thing they call experiential avoidance. And this could be, you know, an example could be someone who didn't want to feel sad, and so to avoid feeling that sadness, you know, they drank a lot of vodka, or somebody who kind of really wanted to go to a party, but they didn't want to feel all the social anxiety associated with meeting new people, and so they ended up not going, right? And it puts forth the idea that a lot of human suffering ultimately comes from us trying to avoid negative feeling states. And the solution to that is, instead of trying to avoid negative feeling states, we end up accepting them, right? And so we want to make space for painful feelings, urges, and emotions instead of trying to avoid them. And just like ACT has diffusion techniques to help us deal with negative thoughts, they have a whole series of what they call expansion techniques to help people deal with negative emotions, right? And this is the idea of accepting that negative feeling and turning off the struggle switch, short-circuiting that negative feedback loop that we were talking about before. You know, it's a place where you're not fighting or resisting or running away from unpleasant thoughts and emotions, and just accepting that they are there, which doesn't mean you have to like them or want them to be there, but you're still accepting the fact that they are there. And so the last of the four mindfulness points is this thing called self as context, which is terribly named and almost as interesting as it is terribly named, right? And we could probably spend an hour talking about it, but we're really just going to spend about 45 seconds on this concept. And this is the idea that there are two distinct parts of the mind, right? There's the thinking self, the part of the mind that's responsible for thoughts, beliefs, memories, judgments. And this is the part that we're really familiar with. And it's also the part of the mind that changes split second by split second, right? And then there's the observing self. And this is the part of the mind that just watches. It just is. It's pure awareness, and it's constant, and it's never changing. And ACT puts forth the idea that we spend far too much time caught up in the thinking self and not nearly enough time in the observing self. And that brings us to values, which is the first of the two, what I was calling the Viktor Frankl points of the 6 core processes, right? And so this is the idea that when you're 80 years old and you're at your birthday party and you have all your friends and family from your life gathered around and they're all giving toasts about you, you know, what is it that you would have wanted your life to have been about? You know, what is it that you would have wanted to stand for? We could take an example of someone who says they really care about education, and we might ask them, you know, would you still want that fancy degree if nobody knew that you had it? You know, and if the answer is yes, you know, we would probably say, well, yeah, they really do care about education, or at least education in that subject. But if the answer is no, we might not identify that as one of their core values. And ACT spends a lot of time trying to really focus on what a person's deep, authentic core values really are, right? And once we've done that, once we've figured out what your kind of core values are, ACT wants you to set long-term goals based upon those core values. And once you've set long-term goals based upon those core values, it wants you to set short-term and medium-term goals that will help you achieve those long-term goals. And a fair bit of time is focused on looking at the difference between a value and a goal, right? A value is something abstract. A goal is something concrete that can be crossed off. And the metaphor you see used often is the difference between like a direction versus a destination, right? My goal is to make it to Canada. My value is to always travel north. Or my goal is to call my grandmother every Sunday. You know, my value is that I really value family. Family is really important to me. And ACT has lots of clever techniques, you know, to help a person figure out their values and goals. The last of the 6 core processes is committed action. And this is the idea that once we've figured out our values, we take effective action that's guided by them. And the committed part means that even when unpleasantness comes up, we'll accept it and still do what it takes to accomplish value-based goals. The metaphor you often see used here is one of the willingness switch. Just like they talked about the struggle switch before, here we have the willingness switch. And this means once we've decided to do something, we're either willing to do it or we're not willing to do it. So another definition for ACT is that A, you accept your thoughts and feelings, C, you connect with your values, and T, you take effective action. Now, there's a lot of research that has been done in ACT and supports it, and there's at least some evidence for ACT being effective with depression, with OCD, with chronic pain, with PTSD, with anxiety, even some types of psychotic disorders, along with a number of other disorders. There certainly aren't nearly as many studies for ACT as there are for traditional CBT, although you could say this with basically any type of therapy that exists in traditional CBT. There's some criticism over the size of some of the ACT studies, and there's some studies that show ACT outperforming CBT for certain disorders. And so what I'd like to do now is take just a second and look at how ACT would approach a problem versus how traditional cognitive therapy would approach a problem, right? And to do this, we need an example. And so what I think we should do is just come up with a completely made up patient, a completely made up example, something that's absolutely not based on anything at all from real life. And so here's our made up patient. Let's call him Jake, right? You know, he's a late 30s male. Some people say he appears younger than his stated age. He's got a certain dry sense of humor that you probably either get or you don't. And he works at a residential treatment center in a professional environment. He happens to have a dog named Lucky, right? And for his job, he has to give a big webinar, and he's absolutely terrified of doing this. And he keeps having the thought, I'm going to humiliate myself. I'm going to humiliate myself. You know, it occurs over and over and over again, right? And so what might be a traditional cognitive therapy approach to deal with something like that? Oh, here's Jake and Lucky, by the way. We can't see who Jake is. He could be anybody. He's faceless. But that is Jake in the front, and that is Lucky there in the back. And so what's a traditional cognitive approach to it? So the first thing we might want to do is identify the automatic thought, right? And if we do it this way, you know, the automatic thought is I'm going to humiliate myself, right? And so Jake identifies the automatic thought, and then he wants to evaluate the validity of this thought, or he wants to figure out, is this thought true or not, right? And so to figure out whether this thought is true or not, he creates a thought record. So he takes a sheet of paper and he draws a bunch of columns on it, right? And in one of these columns, he's going to put all the evidence for this thought being true. And in one of the columns, he's going to put all the evidence against this thought being true. And so he goes ahead and he does this. And he comes up with, for evidence for, you know, I'm going to humiliate myself. He says, well, I'm going to be in front of a lot of people, and I'm going to be really scared. And, you know, Dr. Falk, he presents next week, and he started preparing for this thing months ago. And gosh, I barely know how to use PowerPoint, and the bird presentation incident could repeat itself, and that would not be good. And then he moves over to the next column, the evidence against, and, you know, he says, well, you know, I do have some time to prepare, and gosh, at least half the people out there aren't actually even paying attention. And, most of the time I've given presentations, they've actually gone pretty well. And the bird presentation incident, that was a million to one. That was a fluke. That's really unlikely to repeat itself. And so then he weighs the evidence for, right, and he weighs the evidence against, and he comes up with a balanced thought, something like, although I'm going to be nervous in front of a lot of people, I've always done well on presentations in the past, and this one will likely go well too. So that would be a totally reasonable way to approach a problem like this. ACT would approach it in a dramatically different way. Something that I think is really interesting about ACT is they don't care whether a thought is true or not, right? They're not really interested in the validity of an automatic thought that pops into your mind. They think if you start arguing with a thought, you'll get caught in one of these feedback loops, right? And so ACT is a lot more interested in the question, is this thought useful? And when they ask that, what they really mean is this thought useful to living a life I want to live? Is this thought useful to helping me achieve my goals that are based upon my values, right? And they say if the answer is yes to that question, that this thought is useful, then by all means, keep thinking it. But if that thought is not useful to helping you live a life you want to live, then they want you to diffuse it, right? And so when Jake tries to approach the same problem from an ACT perspective, that thought, I'm going to humiliate myself, pops up, and he uses a diffusion technique to get a little distance between himself and the thought. And then he's still feeling a lot of anxiety, he's still feeling a lot of tightness in his chest, and he feels an expansion technique to help him allow that feeling to just be there, right? After that, he takes a moment to connect with his core values, and he thinks like, well, I do value being good at my career, and part of that is being able to communicate with people, And after he connects with his values, he sets some goals, and he sets a short-term goal of completing this presentation, maybe a medium-term goal of actually giving the presentation, and then he flips the willingness switch, right, and he starts working on it. And so basically what he's done is he's accepted his negative thoughts and feelings using diffusion and expansion techniques, taken a moment to connect with his values, and then commits to taking action. And so my hope is that in a couple of weeks from now, if somebody asks you, what is ACT, you can give them a basic idea, give them the basic gist of what it is. And we practiced that diffusion technique earlier, and I'd like to invite you to try that again a few times today. You can use it with negative thoughts that pop into your head. You can use it with positive thoughts that pop into your head. But give it a try a few times today and see what you think of it. I have some resources that I've listed on this slide. I think all of these are great. The one I want to take just a second to highlight is the book, The Happiness Trap. I think it's a really well-written, really readable book that addresses ACT and ACT concepts. Here are my citations. And I think we're just about out of time, but I want to see if anybody had any questions. One of the questions I'm seeing is, what are clever techniques to uncover values or goals? And I think that's a great question. There's a whole bunch of different ones you can use. Often the place you want to start is addressing what are core values, right? And so some things you can do on that is the idea that you can do exercises like, imagine it's your 80th birthday and everybody's standing around giving toasts about you and talking about your life. And, you ask, what are the kind of things you'd like them to be saying, right? There's different versions of that exercise. Some people like to imagine they're at their funeral and people are talking about them then. I prefer to use the 80th birthday myself. Another one that you can use is somebody wins the lottery tomorrow, and they get this fabulous, extraordinary amount of money, and they're suddenly, freed of lots of other stressors and constraints. And you ask them, well, what would you start doing now that you have the resources to do just about anything? What is it that you would focus on? And those are just two small examples of ways to start brainstorming, what are values? And once you've figured out values in several different domains of life, then you'd start working backwards and start coming up with goals. And then big long-term goals and then short and medium-term goals to help them achieve that. I am seeing a number of wonderful questions pop across the screen. Unfortunately, I think we're out of time and we're not going to be able to address all those. My email address is up here on the screen. Please feel free to shoot me a message if you want. And thank you so much for allowing me to give this presentation.